My name is Dr. Simbara Shimabaya. I work at Gavi, the Vaccine Alliance, where I am a senior technical advisor for primary health care in the vaccine programs team. In the previous module, you learned about integrated bite case management. Now, it is my pleasure to guide you through the 9th module of the course titled Gavi Human Rabies Post-Exposure Prophylaxis Vaccine Program. In this module, you will learn what Gavi, the Vaccine Alliance, is, what our Gavi Human Rabies Vaccine Program support is, how countries can apply for Gavi support, and how WHO and Gavi can assist countries in their application for the Human Rabies Vaccine Program support from Gavi. Gavi, the Vaccine Alliance, is a public-private partnership that helps vaccinate people in low-income countries against some of the world's deadliest diseases. Gavi brings together countries and donor governments, the World Health Organization, UNICEF, the World Bank, vaccine industry, technical agencies, civil society, the Bill and Melinda Gates Foundation, and other private sector partners. Gavi now vaccinates almost half of the world's children, and this enables us to negotiate vaccine prices that are affordable for the poorest countries and to remove the commercial risks that previously kept manufacturers from serving them. Gavi's portfolio has grown over time, with new vaccines introduced in every strategic cycle. At present, Gavi provides vaccines against 20 infectious diseases, rabies being one of them. Based on their gross national income per capita, 54 countries are currently eligible for Gavi support towards rabies control. If you wonder why your country is not on this list, please check our eligibility and transition policy. Gavi offers 3 types of support to countries interested in rabies support. We will support procurement of rabies vaccines for post-exposure prophylaxis, PrEP, but not for pre-exposure prophylaxis, PrEP, not rabies immunoglobulin, RIG, and not dog vaccines. Through VIGS, Vaccine Introduction Grants, we offer financial support for the activities that are necessary to facilitate the introduction of human rabies vaccine for PrEP in a country or an area within the country. Finally, countries should explore leveraging other forms of support from Gavi, such as the Health System Strengthening Grant, Targeted Country Assistance, and the Equity Accelerator Fund where applicable. This will need to be discussed with your respective Gavi Senior Country Manager. That said, please note that Gavi's support is incremental, so it only adds to, but it does not replace existing domestic funding, and it is meant to help accelerate rabies control in programs that are already existing. There are several specific programmatic requirements to consider when applying. Applications should address these requirements to increase chances of a successful review by the Gavi Independent Review Committee. Applications must provide confirmation of country leadership and high-level government commitment to improving rabies control and prevention. This includes the signatures of the Minister of Health and the Minister of Finance on their application and the minutes of the meetings of the National Immunization Technical Advisory Group and the Immunization Interagency Coordination Committee that recommended the application for Gavi support. Countries are required to provide a description of their current human rabies vaccine program and specify how much domestic funding this program receives. The human rabies vaccine for PrEP must be available to all age groups and all exposed people. For example, after a dog bite or any encounter with a suspect rabid animal. WHO and Gavi strongly encourage countries to transition from intramuscular IM to intradermal ID vaccination schedules. More information about ID vaccination is available in Module 3 and later on in Slide 8. But in short, let me remind you that ID vaccination saves costs for the health system because one vial can be used for multiple patients. Saves doses and increases likelihood of vaccines always being in stock, even in remote clinics. It saves time for patients because it requires only 3 visits to the health facility, and increases compliance because being a shorter regimen than IM, it is more likely to be adhered to and completed and therefore successful. Countries can use their VIGs to support this transition from IM to ID and are requested to provide a detailed plan for the training of healthcare workers in ID vaccination in their applications. Gavi does not support procurement of RIG, but in their applications, countries must always describe how they will scale up access to this life-saving rabies biological. Similarly, Gavi does not support the procurement of PrEP, but countries must describe how people with occupational exposure to rabies, such as dog vaccinators and vets, will be protected. Applications must describe how countries will ensure equitable access to human rabies vaccine for PrEP with particular attention to gender-related issues. For example, when a woman prefers to be assisted by a female healthcare provider, countries are encouraged to introduce the human rabies vaccine program in a phased manner. This will aid their early identification of challenges and adaptation strategies for further rollout in the whole country. Rollout is likely to meet fewer challenges if it can rely on a strong integration of rabies control into primary health care services, veterinary services, and local government, and if communities are appropriately informed and engaged. Therefore, countries need to plan for public awareness activities, especially in those areas where human rabies vaccine will be available and free at the point of delivery for the first time. Please go to Module 5 for practical suggestions. Strong surveillance is crucial for planning, implementing, and evaluating rabies control strategies. So, countries are strongly encouraged to implement integrated bite case management to enhance contact tracing and quality data collection. I refer you to Module 8 for detailed guidance on integrated bite case management. Even though Gavi does not support the procurement of dog vaccines, we encourage countries to start developing or finalize a detailed national rabies control plan. This should include measures to ensure access to PrEP, mass dog vaccination, community awareness and engagement, and cross-border collaboration with neighboring countries. Please check Module 4 on how to control rabies in dogs. Finally, countries must provide evidence of One Health collaboration mechanism at national, subnational, and community levels. Module 7 will give you further information about what a solid One Health approach to rabies looks like. This slide explains the Gavi co-financing policy. By co-financing, we mean that governments contribute to the cost of Gavi-supported vaccines by procuring a share of the vaccine doses and injection safety devices directly from a procurement agent, while Gavi covers the rest. Co-financing calculations are based on the number of vaccine doses delivered, that is 1 ml vials, and not the fractional doses used. And also the transition phase a country is in. For example, in the initial self-financing phase, countries are required to pay 20 US cents for each 1 ml vial delivered. So, if a country adopts intramuscular administration, a patient will need 4 vials to be fully vaccinated, and this will cost the country 80 US cents. If a country adopts intradermal vaccination, only 0.6 ml of vaccine are necessary to fully vaccinate a patient. This means that the country will spend only 20 US cents and will also save 40% of the vial for vaccinating other patients. Each time a country moves on to the preparatory transition phase and the accelerated transition phase, their co-financing contribution is recalculated. Countries can apply for Gavi support several times a year. The program was launched in June 2024, and the first 2 application windows are 15th July and 23rd September 2024. From 2025, countries will be able to apply through windows published on the Gavi website, but they can also apply as part of their full portfolio planning process. The Minister of Health can request Gavi to support a consultant to support the drafting of their application. In 2026, a new Gavi strategic cycle will start, and any changes to the Gavi application process will be made available on the Gavi website. WHO too is available to support countries interested in applying for Gavi support. The Minister of Health can ask WHO to provide them with technical assistance to support the writing of their application, coordinate the engagement of rabies partners, and share practices and lessons learned. WHO strongly recommends the National Rabies Program staff to collaborate with the National Immunization Program staff who are already familiar with Gavi processes. I will now give you some practical information about the next steps that interested countries should take. Step 1 is about understanding the rabies challenge in your country. To do so, try to compile the best available data on the epidemiological and economic burden of rabies, including information on human rabies deaths, human rabies exposures, human rabies vaccine and rig use for PrEP, animal rabies deaths, and dog population management. You can use the left-hand side document in this slide to understand how to better compile this data, and the right-hand side scientific paper to get a sense of the epidemiological situation in your country. These data are crucial for the estimation and budgeting of human rabies vaccine dose requirements, and your country can further increase their quality through a reliable, integrated bite case management program. In step 2, know your current rabies vaccination program. First of all, check if your human rabies vaccination program is aligned with WHO recommendations, for which I refer you to these 3 documents and especially the one in the middle. Then, activate or establish the National Immunization Technical Advisory Group and any relevant policy decision-making process to revise or update your country's current human rabies vaccination program and align it with the WHO recommendations. In step 3, prepare, revise, or update your national rabies control plan. On the left-hand side of this slide, you can find a template that you can use. Make sure that your plan takes a One Health approach to rabies control and align with the 0 by 30 global strategy. Use these documents for further guidance. Step 4 is about familiarizing yourself with the Gavi processes. You will have to prepare the application and submit it, then wait for Gavi and technical teams to check its completeness and an independent review committee to evaluate it. Issues may be raised from the application for your country to address before the grant can move forward. In step 5, please familiarize yourself with the rabies-specific Gavi guidance. On the Gavi website, please look for the document titled Vaccine Funding Guidelines and go to the rabies chapter on page 62. Those pages will give you an overview of the human rabies PEP vaccination program, will provide technical information about the human rabies vaccine in the Gavi portfolio, and will explain the content of the application package. In step 6, it's time to familiarize yourself with the application package. It consists of 3 parts: the human rabies vaccine introduction plan, for which we offer a template; the vaccine activities work plan, for which there is an Excel template; and the budget, for which there is also an Excel template. Gavi teams will be available to support countries to understand the templates and application documents. In step 7, you can prepare the human rabies vaccine introduction plan. Make sure it addresses all the key components, including an executive summary, background and country context, goals, objectives, and expected impact and challenges of the vaccine introduction, strategies and policies for introducing the human rabies vaccine program in the National Immunization Program, resources, costs, financing and sustainability, and strategies and activities for the vaccine introduction, including opportunities to improve the immunization program and overall health systems during the introduction. Step 8 is about preparing the other two parts of the application package, which are the vaccine activities work plan and the budget. In the Excel file of the vaccine activities work plan, you can type or select information about outcomes, Gov investment areas, objectives, activities, zero-dose targeting, gender, kind of support requested, and other funding resources. Regarding the budget, keep in mind that it must follow the current Gavi budgeting guidelines. It should be signed off by the Minister of Health and the Minister of Finance, and it should provide information about any external resources received or committed in addition to the one requested from Gavi. Step 9 is the last one, when the Minister of Health in your country will submit the application through the country portal on the Gavi website or an externally shared folder or via email, depending on the type of application being submitted. In this module, you learn that Gavi offers eligible countries the possibility to apply for our human rabies vaccine program support. We provide support for the procurement of human rabies vaccines, the implementation of activities to facilitate their introduction, and the adoption of tools to strengthen vaccine delivery. There are specific programmatic requirements that countries must consider during the preparation of their application. The application package consists of the human rabies vaccine introduction plan, the vaccine activities work plan, and the budget. Upon request, WHO and Gavi can provide countries with technical assistance and consultants to support the preparation of their application. This slide provides you with additional resources from Gavi, WHO, and the United Against Rabies Forum. Thank you for your attention.